Hi, my name is Isabella Kritzer, and I'm a senior at the NTSM residential program in Durham, North Carolina, and in the mentorship program. I will be mentored by Dr. Catherine Coombs from UNC Chapel Hill, and we will be doing our research along with Dr. Parul Gupta and Dr. Christopher Baggett. Did you know that approximately 21,000 patients will be diagnosed and 4,000 will die from CLL in the next year? Chronic lymphocytic leukemia, or CLL for short, is a form of blood cancer that arises in the B lymphocytes which accumulate in the blood and bone marrow. CLL is the most common form of leukemia in adults, and until recently, the chemotherapy used to treat CLL was extremely toxic. Approximately 6% of patients who received this FCR chemotherapy, which contained fludarabine, cyclophosphamide, and rituximab, went on to develop these therapy-related myeloid neoplasms, which were very fatal. Therapy-related myeloid neoplasms are the second forms of cancer a patient can develop from exposures to cytotoxic agents such as radiation or chemotherapy. In patients with CLL, sadly, these therapy-related myeloid neoplasms often cause the patient to die sooner than the CLL did. So starting in 2014, the treatment began to slowly transition from chemotherapy-based to targeted therapies, with the first targeted therapy improved the treatment of CLL called ibrutinib. Ibrutinib blocks an enzyme that promotes the survival of the cancer's lymphocytes, as you can see on the image to the left. By blocking this enzyme, the survival of the B lymphocytes decreases, and this slows the cancer's progression since the CLL arises in the B lymphocytes. So an additional therapy used and approved was venetoclax. And venetoclax blocks a different enzyme, as you can see in the image to the right, that helps keep the cancer cells alive by preventing apoptosis, which means the body is unable to kill the cancer cells. So with venetoclax, the body is able to kill the cancer cells and prevent them from spreading more. So we are trying to determine if the prevalence of therapy-related myeloid neoplasms have declined since the introduction of these new drugs. Due to a decline in the use of FCR chemotherapy and an increase in the use of these targeted therapies in patients with CLL, we hypothesize that there will be a decline in therapy-related myeloid neoplasms in patients over time. So by using the SEER database, which collects cancer statistics across the US, we will analyze data from patients with CLL in pre-ibrutinib and post-ibrutinib time periods to determine if our hypothesis is correct. So from the phenomenal research done on CLL, the treatment has significantly improved. When FCR chemotherapy was still being used in 2005, only 59% of patients diagnosed with CLL would survive 5 more years after the diagnosis. After the increased use in targeted therapies in 2016, over 86% of patients will now survive 5 or more years after the diagnosis. So this means of the 21,000 patients diagnosed with CLL this year, over 18,000 will survive for at least five or more years. With the continuation of research on these targeted therapies, the 5-year survival rate will only increase throughout the years as treatment for CLL will continue to improve as well.